Welcome to another lecture of Psychology 101. This is your instructor, Dr. Shadi Bishai, and in today's lecture, we will begin our discussion on the unit on psychological and biological treatments, which corresponds to chapter 16 of your textbook. So here we go. What comes to mind when you hear the word psychotherapy? Some of you might have an image, perhaps, that comes to mind, very similar to the image that you see in front of you on the screen here. Maybe you have an image of an older, probably white gentleman who listens keenly as a patient who's usually lying down on a couch somewhere. So this older gentleman who's the therapist listens keenly as the patient describes their thoughts and emotions. Although this form of psychotherapy still exists in some places today, psychological therapy has overall, since that image, has really changed and transformed. And it's now become something that kind of resembles like a conversation between two people united on a common goal. Here is a definition of psychotherapy that I particularly like. And if you have a minute to read the following definition, you'll probably note the following elements that are embedded within this definition. Psychotherapy is an interaction between two people that have a common purpose or a common goal. And that goal or purpose is to help the client, one of the people in that particular interaction, helps to help the client work on a specific issue, and that is the overarching purpose or goal. Therapists use their skills and their knowledge to help the client, who is also viewed as an expert of some sort, because the clients or the patients are really viewed as the experts of their own lives. So together, the skills of the therapist and the expertise of the client, they work on a common goal that unites them, which is to help the client get on with the goals of their life. And this process is typically in psychotherapy enshrined in legal and ethical guidelines. Okay, so it's all within that context. There are many psychotherapies that exist. In fact, your textbook actually talks about 500 different psychotherapy brands in existence today. Psychotherapy is basically defined as the treatment of a psychological problem, either it be a diagnosable psychological condition or just a problem with adjustment to life stress or life circumstances. So we're working on a psychological problem of that nature using psychological techniques and tools we know about human psychology. As there are hundreds of different brands of psychotherapy, there are also several different professions and professionals who can actually deliver psychotherapy. Clinical psychologists, social workers, psychiatrists, counseling psychologists. This is just to name only very few professions who can deliver psychotherapy. It's also quite possible to train people with non-advanced degrees, such as bachelor degrees, for example, to deliver less intensive forms of psychotherapy. And you can see examples of that through things like crisis intervention hotlines, where they hire people that are with non-professional or non-advanced degrees. There's actually a very successful demonstration of this in the world. In 2006 and 2007, the government in the United Kingdom rolled out a very successful program which allowed people with less advanced degrees, what they're called, they were called paraprofessionals. So they allowed these people to deliver low intensity forms of CBT for depression and anxiety over the phone or as a guide online to people suffering with these kinds of conditions, like such as anxiety and depression. And this treatment was fully covered by the National Health Service over there, and it rolled out extremely successfully, I believe. So does psychotherapy work? It really depends on how you define success. And there are really several ways you can define successful psychotherapy. For example, should you focus on reducing the symptoms that a patient or a client is displaying as a marker for your success of psychotherapy? How about improving their functioning? If not these two things, right? Like if not functioning, if not reducing symptoms, how about improving their general satisfaction with life or general quality of life? Of course, these things don't always come in a package. That is, just because you reduce someone's symptoms of depression, for example, doesn't necessarily mean this alone will help them increase their quality of life or their functioning. Secondly, once we figure out what we're measuring, right? Once we agree, you and I, on measuring, for example, functioning, or measuring, for example, quality of life as a metric for success of psychotherapy, we have to actually measure it. And how do we do that? Do we ask the clients themselves whether or not they're improving in functioning or having a better quality of life? Or do we ask maybe family members who see the clients very regularly whether or not they've improved since coming to therapy? Maybe do we look at their performance at work or school, expecting that the performance, their functioning would go up as a function of psychotherapy? So the definition and the measurement of whether or not therapy was successful is really very complex. In addition to these issues, some people wonder if we can actually use the medical model at all. And the medical model typically focuses on symptom reduction. Okay, so some people question whether we can actually use this focus on reducing symptoms to gather evidence about whether or not psychotherapy works, which is obviously the dominant perspective. So the dominant perspective is you see whether or not a treatment is successful by figuring out whether the treatment was able to reduce people's symptoms over time. Okay, so some people disagree with this way of gathering evidence, basically, because some have argued that, yes, you need this kind of evidence because it's a form of accountability, whether or not our methods and treatment work. Other people, on the other hand, say you can't really gather this kind of evidence of the success of the treatment because some of these people believe that psychotherapy is more than just a science. Okay, so if it's not just about reducing symptoms, it's more like an art. It's a relationship that you develop with someone, and it's a very significant part of people's lives. So some people think this type of evidence collection is appropriate. Others disagree with them. Even if you use the purely medical approach to gather evidence, which mostly focuses on whether or not people's symptoms have diminished, of course, does psychotherapy work? There has been a debate in the literature that I think still, to some extent, rages on. And the debate has been going on for a few decades as to whether or not there is good evidence to support that psychotherapy actually works, or whether or not some psychotherapies are better than other psychotherapies. For example, really early on in the 1950s, if you remember the same guy from the trait theories of personality that we talked about in the personality unit, his name is Eysenck. In the 1950s, he published research that showed that people didn't really benefit from psychotherapy at all. So if you followed people a little bit after the psychotherapy has ended, their symptoms would return afterwards. So the psychotherapy was not at all effective in reducing their symptoms over time. So Pittman replicated this research in the 90s, showing that psychotherapy was really not effective at all. And then since then, in the 70s and 80s, and I think this particular point still is still salient till today, there have been others that said that, yes, psychotherapy is effective, but not one psychotherapy is better than the other. Okay, so there's not one psychotherapy that's better than the other one. They call this, through inspiration by Alice in Wonderland, they call this the dodo bird hypothesis. Why they call this the dodo bird hypothesis is because there is a little scene in Alice in Wonderland where a dodo bird decides that he's going to run a race between everyone. But of course the track is circular and there's no beginning and end to the tracks. So therefore there can never be declared a winner in the dodo bird's caucus race. So that's what this particular hypothesis in psychotherapy is called, the dodo bird verdict, which is that there's not one psychotherapy that works better than another one. And that was very influential in the 70s. It continues to be very, very influential. Basically, people who hold that position see, they see the general factors, as what they call them, or the common factors of psychotherapy, as the active ingredients in psychotherapy. And these common factors are basically the connection or the relationship or the quality of the relationship that you foster with your therapist, the quality of the therapeutic relationship that you cultivate together. Okay, and to the people in that second camp, which is the yes but camp, they believe that that's exactly what's happening, is that it doesn't really matter about the specifics of psychotherapy. What's important are the general factors. And in fact, there was a study by Strupp and Hadley in 1979 that showed that when distressed university students were randomly assigned to receive therapy from either a professor who was known across campus to be very empathic and a good listener, or a second group of students was randomized to receive therapy from a professional psychotherapist, they actually found that both groups benefited from their psychotherapies equally the same. Okay, pointing to the possibility that these common or general factors relating to just empathic listening and good listening skills are really what's important in driving therapeutic change. Lately, however, and with the advent of a new statistical technique, and the statistical technique pools the effects of different studies, very disparate studies that have been done over time and have different methodologies. You can actually pool them together and come up with one effect size across all of these studies. And this type of new analysis called meta-analysis. And since then, we have created many meta-analyses, and these meta-analyses show that, yes, some psychotherapies are actually better than others. So not only is psychotherapy effective generally, but some psychotherapies have just more evidence in support of them, and stronger, more rigorous evidence to support them. And this is really the position that we will take here in this particular unit, is that psychotherapy generally is effective, and certain psychotherapies work better for certain conditions, at least. So who benefits from psychotherapy? Like who does psychotherapy work best for? About 20% of all people living in the United States have received psychotherapy at some point in their lives. And that's a very similar number to people who receive psychotherapy in Canada. Okay, about 20% as well. White females tends to be the demographic group that seeks out psychotherapy most often. And then finally, psychotherapy is actually, there are multiple studies to show that psychotherapy is equally beneficial for people of different racial and ethnic backgrounds. So there's really no relationship between the success of psychotherapy and the race of the patient. Overall, psychotherapies can be broken into several categories depending on the theories that drive them and the techniques that are embedded within the psychotherapy. Okay? One of the oldest categories of psychotherapies, if you will, is what is called insight therapies. And the goal of these therapies, these insight therapies, is to expand the insight and the awareness of the patient. So insight therapies share the assumption basically that if people just know about the source of their distress, that knowledge alone is enough to help them meet their therapeutic goals. So these insight therapies include things like psychodynamic psychotherapy, humanistic or person-centered therapy, and some forms of group therapy as well. Okay, so they share the common belief that if people just know about the source of their distress, the causes of why they have these psychological problems, then that is enough, that knowledge is enough to institute change. Psychoanalysis is perhaps one of the oldest insight therapies and direct inspiration for psychodynamic psychotherapy, which we will talk about in a few slides. The interest over the years for psychoanalysis has really been waning, and this dwindling popularity or dwindling interest is based on the fact that very few ideas that come from Freudian psychoanalysis and Freudian personality theory are really backed by scientific evidence. Okay, so very few of them are. With this all said, and as I've said in the past, time and time again, I think, psychoanalysis is still extremely influential and has been the source of popularity, if you will. So it fuels the popularity of psychology in the public sphere. And for that reason, it's still very useful, and it's why we continue to talk about it and discuss the history of psychoanalysis till today. With that all said, this is the typical reaction that you get to psychoanalysis. And this kind of reaction existed since the time of psychoanalysis in the 30s and 40s and 50s, but very much continues to bear truth till today. Okay, so this is, if you read this little quote, it'll show you the general disdain for psychoanalysis as a psychotherapy or as a model to understand psychopathology. There are several key ingredients or key elements of psychoanalytic or psychodynamic psychotherapy, some of which we already talked about. The first one is what is called free association, or the client basically being prompted to say whatever that comes to their mind. Basically, Freud and others believe that the more you know about people's stream of consciousness, the better picture you may get of their unconscious drives and motives and conflicts, etc. The second principle or approach is about interpretation, which is the therapist's ability to interpret important instances in the client's presentation or life with their unconscious conflicts or the source of their distress. So what I'm trying to say is the focus of the interpretation goes beyond just what the person does or doesn't do. The focus of the interpretation is to dive deeper and understand why the person is doing the things that they're doing and how those could be connected with their unconscious drives or motives. Okay? So it's basically interpretation beyond just understanding behavior, as I was saying earlier. Dream analysis is also a very, very important skill or approach in psychoanalysis and psychodynamic therapy. And I think we talked about dream analysis, and this is basically when the dream content is analyzed. And the idea behind why psychoanalysts and psychodynamic psychotherapists do this is basically to get clues about the unconscious conflicts and motives. And this goes back to Freudian days, when Freud really believed that dreams are the theater upon which unconscious conflicts are actually projected. So for that reason, they were very important as a target for analysis in psychoanalysis. Resistance is another important approach or important concept, and that's when the client becomes all of a sudden reluctant to talk about things that come up in psychotherapy. And from a psychoanalytic or psychodynamic perspective, this reluctance or resistance to talk about an important issue as it comes up in treatment usually kind of signals important issues that may lie behind that behavior. Okay, so it's an important thing to note in the context of psychoanalytic psychotherapy. So it needs to be probed further, if you will. Transference is when the client begins to have these very intense emotional reactions and almost very intense bonding to the therapist. So much so actually that the client begins to relate to the therapist as if they're an important person in that client's life. Okay? So in transference, some clients, as an example, may relate to the therapist as their father or their mother. And, they're always just wanting their approval. So that would be a transference relationship. Sometimes the opposite of that actually happens, and it's called counter-transference. And this is when the therapist starts to reciprocate. So the therapist starts to relate to the client in this intense emotional way as well. So it works both ways, what I'm trying to say. And finally, the concept of working through, which is the process of really emphasizing, really highlighting, repeating important themes or interpretations that have come out in the course of therapy. And that, of course, helps clients really cement these ideas that are coming out of psychotherapy. Psychodynamic therapy builds on the work of Freud. And with that said, though, so that's important to know because the unconscious still plays a very important role in psychodynamic psychotherapy, okay, which is the evolution from psychoanalytic psychotherapy. However, there is much less emphasis in psychodynamic psychotherapy compared to psychoanalysis, much less emphasis on sexual drives and motives that Freud were just obsessed with at the time. And instead, you have psychodynamic therapists who emphasize the importance of relationships that happen early in life, for example, and how patterns in these early relationships that form very, very early in life, and these early relationships are often called objects. These patterns are often repeated over time, so they're repeated as you're an adult as well. So they also believed, which is again a departure from Freudian thought, they believed that most of the conflict was actually between the id and Freud believed that most of the conflict was between the id and the superego in terms of this tripartite nature of personality, if you remember that from our personality unit. So Freud mostly believed that the id and the superego are usually going at it, while psychodynamic psychotherapists believe that it's the id battling with the ego, or the social parts of our existence, if you will. There are 5 principles or core principles that guide cleanly now psychodynamic theory. Okay, so this is more of a guide to psychodynamic more than it is psychoanalytic theory. Some of which will sound very familiar to you, because remember, it's psychodynamic theory and therapy is just the evolution, the next stage from psychoanalytic psychotherapy, which is more very Freudian. So the first principle is that much of our mental life lays in the unconscious, and it's basically beyond our immediate awareness. The second principle, there are many psychological processes that can actually operate in parallel to one another. So there could be ambivalent feelings that you have for the same person, for example. Okay, so that you can have like conflicting feelings about the same person. You can like them and then feel a dislike towards them as well. You may want to approach them, but also may really want to avoid them. So these are the parallel processes. And these parallel processes that you may have for someone can actually lead you to make very poor decisions according to psychodynamic principles. Much like Freud, the third principle of psychodynamic therapy says that personality is pretty much set by the age you're 5, and these early patterns basically shape how you're going to relate to others as we're adults. So no pressure there on the first 5 years. That was sarcastic. Lots of pressure. The fourth principle that is guiding psychodynamic theory is that we each have a mental model or a mental representation of ourselves and a mental model and mental representation of important relationships around us. And these mental representations, depending on how skewed they are, for example, can guide our behavior, but can actually be the source of psychological distress and psychological symptoms. Finally, the fifth principle that's guiding psychodynamic psychotherapy, and this is again a departure from the ideas of psychoanalysis. Psychodynamic therapists believe that it's not just control of sexual impulses or needs that we need to continue developing to reach our potential and to reduce psychological symptoms, but also there is a fundamental need to grow up, basically, which is again very the more positive side to the psychodynamic psychotherapy. So they really believe that there's a fundamental need to mature and to develop in our relationships and become independent as adults. So the process of psychotherapy within psychodynamic psychotherapy basically flows through important stages or tasks, and there are three of them. First, the therapist develops a strong emotional relationship through transference. If you remember what that means, just developing that really strong bond, relating to the when the client relates to the therapist as if they're a very important relationship in their life. So first, you have to develop that emotional relationship through transference with the client, and key in basically on the themes of unconscious conflicts. Okay, so through these early processes, you start understanding what might the themes be in this person's unconscious conflicts, if you will. The second task or the second stage is work through the transference relationship with the client. So actually trying to understand these patterns and like I was saying earlier, repeat and emphasize these patterns so that the client would really understand. And then the third, and given how intense the relationship has been so far, right? You're building a relationship, you're doing transference and all that jazz. The third task is to terminate therapy very effectively, right? Because you got to help the patient deal with the feelings of loss. You got to help the patient not activate their fears of abandonment, for example. So negotiating that loss with the patient or the client becomes extremely important. So there have been, as you can imagine, a number of criticisms leveled against insight therapies generally and psychodynamic therapy specifically. For example, there is research that suggests that insight into the source of your psychological distress may not at all be necessary for people to feel better or for their symptoms to reduce. Okay, so just knowledge of where your problems come from is not necessary. It's not necessary for you to know the causes of your psychological condition in order for you to feel better. In fact, the most reliable way to decrease symptoms is through practicing a new skill or engaging in new behaviors, okay? Regardless of whether or not you have insight into your problems. Secondly, and this has been an issue for psychoanalytic therapy for a while now, many of the concepts are not falsifiable. So many of the concepts in psychodynamic psychotherapy are not falsifiable, and therefore very difficult to study in a scientific way. As you remember, falsifiability is one of the core principles of science. You cannot have a hypothesis that's unfalsifiable. Wait, you cannot have an unfalsifiable hypothesis, is what I'm trying to say. I did a double negative there. So basically, there's very little scientific study of psychodynamic psychotherapy. There's also huge emphasis on defense mechanisms such as repression of traumatic events or traumatic memories. And actually scientific studies or evidence are actually telling us that repression of memories or repression of traumatic or hurtful memories is definitely overstated and might not even exist at all. Okay, and it's a really important central concept in psychodynamic psychotherapy sometimes. Good news is, in the 1960s, 70s, and 80s, there was a rise in more accountability related to cost efficiency of psychotherapy, right? So they needed to save resources. So you gotta have, and originally psychoanalysis and psychodynamic psychotherapy, the course of them was years and years. So people would be in treatment for 4 or 5 years, typically going to treatment maybe twice in the same week. So they're incredibly cost-heavy types of psychotherapy. So there's a lot of concern about cost efficiency at the time. So what happened at the time is that people started developing short form psychotherapies that are typically 16 to 30 sessions. And thankfully, there are brief versions of these psychodynamic psychotherapies that are about 16 to 30 sessions. Even such brief forms of psychodynamic psychotherapy, though, use the same principles that we talked about earlier, or the same processes or tasks that are the pinnacle of psychodynamic psychotherapy. So first, you got to bring to awareness unconscious conflicts. Then you got to identify important relationship dynamics, and then you got to work through a transference relationships to enhance the dynamics of these relationships. So you got to identify important patterns early on, and then figure out how these patterns are impacting people's lives right now, and then you got to instill new patterns so that the patient improves their lives going forward. Thankfully, these brief forms of psychodynamic psychotherapy seem to actually do fairly well, especially for things like depression. There's also research showing that the short form psychodynamic psychotherapies are showing promise, believe it or not, for treating conditions like panic, for substance-related issues, and even for borderline personality disorder, which is quite a severe condition as well. There are a number of conditions, though, that the treatment is likely not appropriate for, including things like psychosis and schizophrenia. And secondly, there are a number of other treatments, and I'm gonna name drop cognitive behavioral therapy right now. So there are a number of other treatments like CBT that have a far stronger research base and research support. And then finally, and as mentioned time and time again, the theory upon which the therapy was built lacks very important scientific validation and scientific support. Okay? And if we don't understand mechanisms, we don't know anything. We don't understand how the therapy works or purports to work, then we don't have much to go on. So overall, psychodynamic psychotherapies remain relatively questionable scientifically, at least the theories upon which they were erected, if I may use that word, the theories upon which they arose are still questionable scientifically. But the brief forms of the therapy is better than receiving no treatment at all. Okay, so if I have a family member and the options were to go to short forms of psychodynamic psychotherapy or brief psychodynamic psychotherapy and no treatment at all, I would definitely recommend brief forms of psychodynamic psychotherapy, which is better than nothing at all. But with that all said, it's still not as effective. So even brief forms of psychodynamic psychotherapy are not as effective as more scientifically robust treatments like CBT. Okay. Finally, psychodynamic psychotherapies, in whatever form they appear in, either long or short or brief or whatever, they're not effective for things like psychosis, okay, or things like schizophrenia. So it really depends on the condition for which you're wanting to find interventions for. And psychodynamic psychotherapy does not appear to be indicated for a problem such as schizophrenia or psychosis. Last, of today's lecture, let's talk about a second form of insight therapy. Okay, so remember, insight therapies worry about teaching people the source of their distress, and this knowledge is believed to be very important in the therapeutic change. So one of these is also a humanistic, or what is called client-centered or person-centered psychotherapy. So remember the humanistic model of personality? Okay, so remember that with me, which is really founded on the idea that if you make enough room for people, people's inherent goodness will want them to strive for self-actualization and self-improvement. So if you remember that, you'll also know that it emphasizes people's free will, their capacity for growth and development, and the ultimate belief that people are just inherently in at their core, they're good. And these humanistic psychotherapies, similarly, they emphasize personal responsibility, and unlike psychodynamic psychotherapy and psychoanalytic psychotherapy, which typically focus on the first 5 years of life, as you can imagine, if you believe most of personality stops happening at the age of 5, you want to know a lot of things about the first 5 years, as you can imagine. So lots of time in psychodynamic psychotherapy and psychoanalysis is spent in those 5 years of life. But humanistic and client-centered or person-centered psychotherapy often focuses on the here and now. So that's a big difference between humanistic and psychoanalytic or psychodynamic psychotherapies. Person or client-centered therapy was developed by one of the major founders of the humanistic model of personality, if you remember, again, our lectures. And honestly, he's one of the most influential clinical psychologists that ever existed. His name is Carl Rogers. To Rogers, the role of the therapist is to provide an atmosphere for the client where the client's natural tendencies to grow and to self-actualize are completely cultivated. Okay, so that's the role of the therapist, is to cultivate this environment for their clients. But to do that, according to Rogers and others who practice the same psychotherapy, the therapist has to show genuineness and authenticity in their interactions with the client. And they have to express this unconditional positive regard for their client. And they also have to show very, very good empathic understanding. Okay, so these are the conditions that must be cultivated in psychotherapy in order to see growth. And these are really these three conditions: the authenticity, unconditional positive regard, and empathic understanding. These three conditions are the foundation of what I was talking about earlier, the common factors or the general factors in psychotherapy. This is how you build really strong relationships as foundation for whatever therapy you're doing. So how well do the humanistic or person-centered therapies do? Well, much like psychoanalysis or psychodynamic therapy, the core principles guiding humanistic treatments are very difficult to falsify. Okay, so they're not put in falsifiable terms, and for that reason, they're very difficult to test scientifically. And there haven't really been a lot of scientific tests of the core principles of a humanistic model, except to say that there have been ecological psychology studies, which ecological psychology compares our behavior with the behavior of genetically related mammals, and much of this research, of course, is showing that like chimps, who we're very, very close genetically to, are capable of horrendous things. So it's not all good and rosy, is what I'm trying to say. So it's very difficult to test scientifically some of these ideas. And if we have tested them, there has been some evidence to go against this basic theory. With that all said, though, there's a lot of evidence to suggest that the three conditions of genuineness, positive regard, and building empathy or having empathy that Rogers really emphasized, These three conditions appear to be very important, actually, in the context of therapy to facilitate therapeutic change. So we still carry with us these elements of the humanistic model in all forms of psychotherapy. Again, these forms of treatment are effective than no treatment at all. Okay, so don't get me wrong. If a family member asked me and the options were humanistic or person-centered psychotherapy versus no treatment at all, I would definitely recommend person-centered or humanistic psychotherapy. But with that said, there are other treatments that have a more rigorous scientific support behind them. Again, like CBT, and I hate to say that again and again and again, but that is just the reality. Okay, so there are other treatments that have garnered more research support for them. Until next time.